Welcome to Cancer Bites, bold voices, big insights, and unstoppable energy, because cancer doesn't get the last word.
Thank you all so much for joining us today for our episode of Cancer Bites, our podcast. We are now I believe is this our fourth or our third? Siobhan, time is going so fast, but our mission, as we do this podcast, is to live fully informed and supported. And we also want to infuse hope and purpose during a time that is so associated with despair at worst and apathy at best. Like, we think the power of community in, the fight for this feeling of well-being during cancer, and breast cancer in particular, that this community can really catalyze healing. And, the month of October, of course, our shows are going to be focusing on patient resources and awareness. So without further ado, I want to go to our incredible guests today for our podcast. We have with us Dr. Christina Pozo-Kaderman. She is the senior psychologist and the director of the young adult program at the Dana-Farber Institute, and she has many years of experience in psychosocial oncology at the Harvard Medical School faculty. So, this is something that she really encapsulates in her book. And this is a very important book. This is a new book that's been released. It's called Coping with Cancer in Early Adulthood, From Diagnosis to Treatment to Day-to-Day Life Changes. And I think that one of the reasons this book is so important is that it focuses on guidance, empathy, and practical tools, most importantly, for patients as young as 18 to the age of 49. And this is a group of women and patients that face unique challenges on their cancer journey. And we're really happy to have one of the co-authors of this book with us today. And, I already gave an introduction about all the amazing things you do. So welcome so much to Cancer Bites, Dr. Pozo-Kaderman. And I want to also mention the co-author, Saul Wisnia, and also the amazing work that Dr. Pozo-Kaderman does with the Department of Supportive Oncology. So I'm going to jump right into our first question, Dr. Christina. What inspired you to co-author this book, first of all?
Well, thank you so much, first of all, for having me here. So there's three parts to the inspiration. So the first part actually goes back to my childhood, and I shared with you a little bit before we started that when I was a young child in the late 60s and 70s, my mom herself, a young adult, was diagnosed with a head and neck cancer. And so her cancer recurred 3 times, and it was head and neck, so it was very visible. She had the last recurrence, a major surgery from the back of her ear all the way down her neck to right before her breast. She had part of her head shaved. So it was, for a young child, visually, very jarring to see these major changes. And then she had difficulty with speech for that time period. She also had difficulty eating. And so I just remember as a child watching this happen and feeling a lot of fear and worry. And my mom really, at that young age with 2 young kids, I think just did what she needed to do and really recovered amazingly well. It did take time, and I think she had great community and faith, many things that helped her. I don't think at that time people talked about cancer, so I think whatever fear that she had of dying, I sort of picked up on that. And I just remember growing up feeling somewhat isolated as a child, right? That all of the other kids had moms and dads that were healthy, and I was very aware that mine was different. So I really knew since a young age that I wanted to work with young people that were going through cancer, and in the emotional part, because I was very tuned into that. Was an anxious child growing up because of that. And so I knew. Then I spent my whole life, working in the area. So I've worked in the area for more than 30 years. And even before that term young adulthood was used, I would just ask, when I was in training at Sloan Kettering, I would always just ask, can I get the younger patients? And recognize from that time, right, that there's something different and unique about this developmental stage in life. They don't fit in with the kids, but they don't fit in with the 70-year-olds. Not that I'm minimizing what 70-year-olds go through, but different. And then the last part that about why I wrote the book is that while I noticed that there was a need for this specific age group to get attention throughout my career, I then also noticed that while there are great books written out there by young adults talking about their experiences, and they are fantastic books out there, but they are from that person's perspective, right? And so you could learn a lot from reading somebody's perspective, but there was nothing written from a mental health professional's perspective on how to cope and deal. So there was this gap again in having a book specifically from that perspective, if that makes sense. So those were the reasons why, the book came about.
I mean, that's really fantastic. And I think, the importance of seeing that there's a gap, they're seeing that this informational gap that needs to be filled and then doing something about it is so admirable. And you touched on it in your answer right there, but can you tell us a bit more about what makes the 18 to 49-year-old age group so unique in their cancer journey? We'd love to hear more about that.
Well, so let me also add to my answer there, and it ties into this. So the acquisitions editor that got me to write the book actually herself is a young adult with cancer. So she recognized herself that there was this gap. So I noticed the gap, but she noticed it really from a publishing end. And when she was diagnosed, she was very drawn to some of the events and programming we had at Dana-Farber and came there, and that's how we met. So I should say that it was that joint decision that there is a gap and it needs to be done. And that gap is really because young adults are in a stage in life where you don't expect this to happen, right? I mean, this is a time in life that you are in many ways considered to be at your peak of health, right? So you are feeling at that point like you can do anything, that you have endless energy. And there are so many major developmental milestones at that point, right? This is the time when you're figuring out, who am I as a person? What do I want to do career-wise? Do I want this career? Maybe you're changing careers. Do I want to have children or not? Do I want to be in a relationship? Who am I in terms of sexual identity? You're making all these major decisions and figuring out who you are. And then you get diagnosed with cancer. And it totally interrupts and disrupts that. So, when you're 21 or 22, you get diagnosed with breast cancer. You just developed breasts less than a decade ago. And now you have breast cancer. You're just getting comfortable with your body. You go to college, everybody's dealing with how they look, how they feel, and now you're going to lose your hair. So as one patient said to me, do I want to be the cancer girl on campus? It's like, and then if you're older, you could be in your late 20s, your 30s, you may not have made a decision yet. Do you want to have children or not? Today, a lot of women wait and men do too. And now all of a sudden you get diagnosed and it's like, hey, you got to think about this. You got to make a decision now. I had a 20-year-old that was diagnosed with cancer who said to me, I haven't even gone on a date, much less think about my fertility. So, it's that whole sexual part too. And as we know with, women with breast cancer, they often may get put into premature menopause. So here you are, 35, having hot flashes and vaginal dryness when, this shouldn't happen for another 20 years. And so it's just a stage in life where you're not prepared to deal with all of this. And most importantly, with your mortality. Right? This is a time in life when you may think about death, but it's in a very abstract way. Maybe you talk about it in class, in a philosophy or literature class, and it's like, an intellectual exercise. Or maybe if you're a little older, it's your parents or your parents' friends that are going through something tough, but you don't expect that to happen to you. And so it really just takes you out of what your, whatever is in quotations, normal life should be. And as some of my patients say, there they are sitting, getting their chemo, and they talk about FOMO, fear of missing out. They go on social media and, there's a friend talking about, who they're dating or, interning in a new, job possibility or new baby or pregnant or getting married. And what are they doing? They're sitting there getting chemo. So while their schedule used to be filled with all of those activities before, now their schedule is filled with having to go to the hospital. So it's just such a different experience. And again, in no way am I minimizing the 70-year-old or the 60 that, I'm there. So it's not like I'm minimizing it, but it's very, very different. And you've had a lifetime of hopefully making some of those decisions rather than having them, be disrupted, interrupted, and sometimes taken away, at least for a while.
Yeah, that's really good. I love how you weave in, the physiological things that make it unique, the social aspects of socialization and being a woman, and then, aspects of gender and aspects of what it's like, the pressures of social media, even in the age that would make this very specific. So I think you definitely covered treatment as well as like some of the day-to-day changes that we see. I think you really gave some great examples of that. At this point, Siobhan, I wanted to know if you wanted to ask anything. We can turn it over to you to ask a couple of questions.
Dr. Christina, I love you already. I think that you have great energy. We had a long conversation that took a bite out of the show, but we're all here for the time that it takes to find out everything we can about what you bring to the table. And I have a question about the caregivers. I think they're very, very important. I happen to have the best caregiver in the world. His name is John Kendall. He had cancer 23 years ago, testicular cancer. They took him right down to nothing, like his white blood cell count was, nothing. He went through one of those white light experiences where he was so weak and so sick that he saw the white light and they didn't want him there. So they threw him back into the flow of life, and it changed him as a person. And he's gone on to invent agricultural technology and get closer and closer to the source, spirit, God. So when I got this, it was a shock because I'm strong. I'm, very healthy. And it's funny to say because I have cancer, but I'm very healthy. Up to the minute I had the diagnosis, I thought it was fine. There was nothing wrong with me. And he has been such an important part of my journey, because I'm not in recovery. I'm not in remission. I'm still going through it. I'm still going through treatments. I'm in my 4th round of chemo. It's actually a pill. I don't have to go and get plugged up to an IV and sit there, and I won't lose my hair. Thank goodness, because it took me the whole pandemic to grow it this long. So I'm very grateful for that. But if I didn't have him, I can tell you right now, I would not be here today, because it was his spirit and his resolve to keep me alive. He stayed up with me the night I went through the dark night of the soul, where I wanted to end it. I was thinking of, how can I get him to put a pillow over my head and end it for me? Because he'll be better off without me, because God only knows what's going to happen. Like how much worse is this going to get? He's going to have to care for me for the rest of his life. I'll be useless, right? Like all these things went through my head.
Well, but Siobhan, I think you touched on a point there that's important, which is when somebody gets a diagnosis of cancer, the first thing they think about is, I'm going to die from this, and I'm going to die soon, and I'm going to make everybody around me miserable. And I think that even though our treatments have changed so drastically, and people are living longer with cancer and sometimes being cured of cancer. And your husband's a great example of somebody who really was cured of cancer 23 years ago with testicular cancer. Mm-hmm. So, but I think that what you're saying is that immediate thought is, I'm going to be a burden. I'm going to die of this. So why not do something to end it sooner than go through all of it? And so, I think it's so important that he was there to say no, you know, and also that as we talked before the show, you realized, yes, there are options for me, right? There is hope. There are treatments. And as you're saying, you're in treatment, and yes, you have your tough times. Yes, physically you're not the same, but at the same time, the treatment is helping, right? And you're doing the show. You're living a meaningful life, right? And I think that what you shared, I think, is so important, because most people will have that dark moment when they hear about it, and they will be filled with shock and fear and devastation, really. And if they have people around them they love, they most of the times do worry about that initially. So yeah, you were going to ask about how family, right? And the role of family.
Yeah, just because, you know, my family is so far away and they really can't do anything more than send me notes of encouragement or emails, or pick up the phone and say, oh, it was your, you know, fluid removal day. How did it go? They're not here, and they can't get here. It's economically ridiculous to ask them to keep flying to see me and to look after me or come and clean my house. You know, I haven't had my floors washed in a very long time. I've done it. John and I have done it a few times, but you know, there's a whole lot of things that fall by the wayside, but it is your immediate family that has to deal with all those changes. Like John had to learn how to do the laundry. I was in the hospital for 2 weeks. I asked him for pajamas. And then he'd have to clean them because I didn't have 2 weeks worth of pajamas. I had like 3 pairs of pajamas or something, you know, like so he had to take the dirty laundry home and learn how to actually turn on the washing unit, the laundry unit, and figure it out himself. He was batching it again after 32 years. And I don't let him do the laundry because I shrink things on my own. I don't need another person to do this thing. So he's never really learned how to do these things. And I remember one night he showed up. He would surprise me. He'd be on the phone. I'd be like, oh, I don't feel good, and I just right, the whole very dramatic conversation. And it was like, and he goes, it's too late, you know, it's 9 o'clock. It's too late for me to come back to the hospital. And then half an hour later, in comes this guy with a pile of laundry. He washed it and dried it, and he didn't even fold it. He just brings this pile of laundry. I'm sure underwear and socks were dropped in the hallway. He walked through security. He came in with it, and proud as a peacock. He brought in this pile of fresh laundry. My pajamas were there, and I was happy again. And the joy that he brought to me by just caring enough to do that, he didn't have to get up and, you know, get in the truck and drive all the way to the hospital, take the laundry in, and look like a fool walking in with all this laundry up to the 4th floor or whatever it was. But he did it, and it's that connection that you need to have.
Yeah, and I agree with you. I mean, research and my clinical experience obviously shows that having, you know, people who support you, you know, not everybody has that one person, right? So, you know, some people are very fortunate to have that one person. Some people have, if they're younger, it may be their parents, it may be their siblings, or it may be the family that they create and choose to make, right? Everybody's different in who they consider to be their family. And one of the things that I talk about is that sometimes we expect that our family can do it all. And, you know, maybe John is an exception, but most people can't quite do it all, right? In a sense, there's different types of help we all need. Sometimes we need the concrete support, the laundry, driving us to treatments, the meals, maybe a gift card for gasoline. There's other people, so some people are really good at doing that and they're great at it. There may be other people who are really good at connecting you with resources and more of that informational support. And we talked about some of the people that you knew even before getting diagnosed, Shaban, and reconnecting with those people. And then there's people who are really good at providing emotional support. And emotional support is not often what we think it is. Yes, it's being there, and often it means just being there, which is a lot. And I say this because so often people think that what you need to do when somebody's going through a tough time is talk and give them advice. And, often platitudes are very quickly expressed. Don't worry, everything's going to be fine. Everything happens for a reason. Those are not helpful. Those platitudes are not helpful because, as my patients often say, how do you know everything's going to be fine? Nobody knows. How do you know everything happens for a reason? Everybody's different. So often the most important thing you can do for emotional support is sit there and hold their hand when they're watching TV or getting chemo or letting them talk. And what's really interesting about that is that it sounds easy, but it's really difficult to do. Because when you love someone and you see them emotionally struggling, you want to step in and you want to say something. And so being able to hold back and be there with them is oftentimes the most important thing. And I want to add this to it. So often when we do have a partner, we think that that partner should be able to meet all those needs. But as you just said, a partner is now taking on additional responsibilities. So if you're young and you have little kids and you have a full-time job, now you need to do all of that in addition to what you were doing before. So expecting that one person can do it all is not the best way to approach. And so if you can match up people with what are their strengths, and I often say, maybe put out a text, to a group or all the people that are contacting you, put out a massive email and say, I need help with these things, and let people sign up for it. I can bring you a meal. I can drive your child to school. If you're in college, I can pick up your homework, like different things that people can do. We definitely know that having emotional and social support is critically important, but it's also important to realize that it may not always be your family. It may be the family you choose. It may be friends, and that usually not one person can do it all. And I will say the kids, as I said, my personal experience, you can't forget kids. If you have little kids, they're going through this as well. And if you're a young adult and you have parents, so if you're 30 and you have 50-year-old parents or 55-year-old parents, they also are going through a lot because they're talking to their friends and their friends' kids are working. They have kids themselves. And now they, as a 55-year-old, they have a kid who's going through this. So they're very isolated. So it's really, like you said, Shaban, it touches everybody in the family. Yeah.
I love the hand holding because John was there when I came back from one of my thoracentesis when I was in the hospital. And that's when they puncture your lung into the air sac and they draw out the body fluid that's seeped in because of the cancer. And I came back and I couldn't breathe. And he was sitting there and he was watching me go through, I don't know if it would be called a seizure or something like that. I was choking. I couldn't, and he was sort of behind me a little bit because the chair was just to the side, and he put his hand out and I just grabbed his finger. And I held onto his finger and the tears are streaming down my face. The nurses and everybody have rushed to my bedside, tried to figure out how they can help me. I was probably giving me drugs, like intravenous things to calm me down or something to help me I couldn't breathe and it was choking. And I remember I just grabbed his finger and I held on tight. I think I hurt him, but it is now a thing. The other night I had trouble and we were in bed and he just put his hand out and he put his finger out, and I grabbed his finger and I could feel his pulse, right? His heartbeat. and it calmed me down.
Yeah.
And it's probably one of the most important things he ever did for me. It was
Yeah.
just give me the finger.
That's really beautiful.
That I'll never forget, Siobhan. Oh my goodness. Give you the finger. Poor John.
Yeah, I
This is
know.
what it came down to. That's
The
so
humor
funny.
is a big part of
Yeah,
it, right?
that's enormous. That
Dr.
is
Christina?
Yeah.
Humor.
that
That's
is a big part of it. I mean,
Huge.
yeah,
Yes.
yeah,
Yes.
yeah. And I think you know, that humor that can come in the and forge those private moments and those private jokes that really, you know, help you to get out of those dark places. So that I agree with you, Dr. Christina, that I do admire that Siobhan has shone light in those places to show that we have to incorporate and embrace that darkness and that shadow at the same time. And I think,
Exactly.
you know, that's one of the ways that we can process it. And I mean, there's so much wisdom discussed already, but in terms of like if there is a particular way to sum up a takeaway, what do you hope patients and the loved ones we just discussed hope to take away from the book?
I think that probably what I think most important is that this is very difficult. Getting diagnosed with cancer when you're young is extremely difficult. And so, yes. But I also want to say that there are ways that you can get through it, that you can cope through it, that will make it more bearable, and that can bring you at times, and everybody's different, but closer to people, and can in many ways change you. How it changes you may take some time. And I say this because some people say to me, you know, like, I'm not happy about it. No, I don't expect you to be. So it may take you time to figure out how it has changed you, but it will change you, and there are ways to get through it. The book, I hope, makes something that's really challenging more bearable and easier to get through, if that makes sense.
Yeah, that does make a ton of sense. So, and from what you're saying, it does seem that it's evident that there has been a real evolution in terms of, you know, how support for young adults has evolved. Do you want to tell us a little bit about that in terms of your experience?
Yeah, it really has evolved greatly. I think that, you know, if I go back 30 years, as I said, there was no term for young adults with cancer. That just didn't, I would just say, can I just see younger patients, or, you know, patients in their 20s, or the ones that have kids? I mean, that's how I would ask. So it really has changed greatly in the last 10 to 15 years. We still have a ways to go to recognize that this is a specialty. So it's not like you would just lump these people in with the kids if they're 18, or lump them in with the adults. It is a specialty, and it has like it's its unique developmental stage in life. And I would add that the one area that I think still is not quite understood is really post-treatment. When people finish treatment, people expect that life goes back to normal. You snap your fingers and you've been in treatment for a year, but now in 2 months, you're going to go back to the way you were before. And that just doesn't happen. So that would be one thing that I think there still needs to be more information and education. Your energy took a year to decrease. It's not going to come back. And so you're going to continue to be out of sync with your peers a little longer. It will get better. You know, your cognitive, you know, changes that you go through treatment as a result of treatment are very real. They do get better, but, you know, don't expect that it's going to happen immediately. And that's really hard when you're young, you're at the prime of your life, you are used to multitasking, you're used to endless energy. So I think those are areas that we still need to focus on more, and better educate not only the person going through it or the patient, but the family. Because they often think you finish treatment and let's jump back to life. And you're not the same, right? There's a new you, a new normal is what I usually say, a new normal, which is different, not better, not worse, but different than the one before you went through all that treatment.
My goodness, thank you. So, I mean, we're going to look to shift gears a little bit and move into what we want to say in a friendly way, rapid fire questions for you, Doctor. And we know that you can handle it, and you've said that's okay. So the first question that will, you know, we'll give you a short and snappy response. What is one myth about young adults and cancer you'd like to bust?
Well, I think I was going to say the same thing, that, you know, you don't finish treatment and immediately go back to normal. Be patient with yourself, show yourself self-compassion, the self-talk, be good to yourself. So that's what I would say.
Great. I love that. And that's something we could all do with actually. Positive self-talk can help heal everybody.
Yes,
Okay,
gradually
great.
give yourself time to recover.
Yeah, exactly. And then on to our next one. What's the number one coping strategy you would recommend for stress in daily life?
Well, I can't give you just one, so I'm going to give you a couple really quick. I think that I have a 60-second meditation that I really recommend where you tune into your senses and the environment. Diaphragmatic breathing, which I use myself all the time, and it's easy with listening to a song for the length of a song. And then the third one I would say is, again, self-compassion. Talk to yourself with kindness, be patient, don't say harsh and, difficult things to yourself because you're going through a difficult enough time.
Perfect. And then what do you think is the most overlooked challenge for patients in this age group?
I don't know that the most overlooked, but I would definitely say that sexual health is not attended to enough with young adults or any age, but I really worry about the young adults. So I would say that needs to be talked about. It's normal to have changes during treatment and even a little while later. That is normal. And just saying that to young adults when they start treatment, that it can get better, that there's things that can be done, that you could be linked up with resources, I think is critically important.
Okay, super. Wow. And we're moving through these questions well. Okay, and the next one is, what's the one thing you wish every young adult with cancer would hear from their healthcare team?
More information about what it's like to go through the treatment, not only from the physical part, but the emotional toll that things take, and understanding that a little bit better, and more education on the emotional side effects that come with some of the medications. Those aren't talked about enough. Okay. So for example, most patients I'll say this quick, most patients when they get chemo, for example, or part of some chemo regimens get steroids. And those can cause sleep difficulties, hyperness, rapid heart rate. It's still a steroid. It's different than the athletes, but you still get irritable, and patients don't get that information. And so they're feeling all these emotions and they're sort of like, where's this coming from? So I wish that the healthcare team was better at explaining the emotional, cognitive side effects from drugs. Same thing with premature menopause, right? You're getting Lupron or you're getting something like that. And, that's going to affect you emotionally.
Okay, awesome. And what about, what piece of advice would you wish caregivers could get? What's the best piece of advice do you think they should get?
Stay connected. So one of the things that I hear often is that patients feel that they've been cancer ghosted, which means, they tell people about it and then they're ghosted. Nobody calls. They don't know what to say. So stay connected, even if it means just sending a text once in a while and saying, thinking about you, and just offer to do things. Don't give advice, but offer to do things that you can do and you can fit into your life. But don't cancer ghost.
Yeah, oh, that's a good term. We have to remember that one. Don't cancer ghost.
Well, the patients teach me everything I know. They teach me. Yeah.
Oh, wow. Okay, so and this is a difficult one because I've looked at the book. The whole book is incredible, but if someone could only read one chapter of the book, or let's say two, what would it be?
Okay, I would say that the two chapters that I think are really, really critically important would be, the emotional aspects, right? Because that's not talked about anywhere else. So that would be chapters 5 and 6. But I also think there's a chapter on how to utilize mental health, which is important. And then the post-treatment chapter 8 is important too. So those are the ones that I think are just very different than what you'd get anywhere else.
Well, that's incredible. And I would say that I really did enjoy the book. There are a lot of general life lessons. Again, it's not to minimize what cancer is, but if you're someone who is a cancer advocate like myself, or if you're someone who, is caring and empathetic, there are lots of lessons we could learn from this book. And that's one of the things I enjoyed most about it. So, I hate to close this conversation. We have to have you back, Doctor, because this conversation.
Oh, Stacy, thank you. Thank you for having me so much. Thank you.
We loved your insights, and, just a little teaser for the next episode. We're going to have a 9/11 first responder Dominic DiMacci and his attorney on, who are going to talk about the 50 men who ended up having a breast cancer partially as a result of the environmental factors, or largely because of those factors from the 9/11 tragedy. And then Siobhan, I'll hand it over to you to do a little promo, and then you can also wrap up.
I'm doing my very best Vanna White.
I like it.
But
Yeah,
my background is taking a bite out of the book, Dr. Christina. But Coping with Cancer in Early Adulthood is Dr. Christina's new book coming out through Simon & Schuster. It's already out, or it's coming?
Today, you're having me. It's coming out today. Yes.
We're on the Today. This is the Today Show, Cancer Bites. Yeah.
Yay.
Dr. Christina, thank you. It is an amazing book. I'm already gifting it to two of our guests who are young adults.
Yeah.
They were here 2 weeks ago, and everything that you talked about, they talked about. It was so incredible to hear that. And I want to say that you talked about meditation and breathing exercises. It's so important. I've done those for years and years and years. I've always said all the cells in my body are healthy. All the cells in my body are healthy. I do affirmations, love, love, love. I did not know I was ill, and probably somebody who wasn't as healthy as I was would have figured it out a long time ago. But I came into the fight strong, and I have this I give myself grace, like you're talking about, and I have a great caregiver. He's got me walking 3 miles a day now. Now, just remember, my lung was filled with fluid.
That's amazing.
Now it's sealing, and but I have that anxiety that you were talking about. It's probably some side effect of the drugs. I'm on innovative drugs. I'm Kisqali and Letrozole for, they're working amazingly well. And I don't feel sick most days, but like you said, I have my days, and we all need a Dr. Christina in our life, because you have your oncologist, you might have your naturopath like I do with Dr. Ronnie. And I have one of the top oncologists probably in the nation, in Scottsdale, and she deals only with breast cancer, which is what Dr. Christina said. If you're, get somebody who only deals with the cancer that you have, get the top person if you can. And I think we all need that person that is able to break it down, the emotional side of the journey that we go through. All cancers, everybody goes through it. I read a lot of Facebook posts for people. Just this morning, this woman has just been diagnosed. Her tumors are only millimeters, like millimeters. She's, early stages, but she's so afraid. And I feel her, because everybody's journey is different, but I think the emotions are the same, because you're up against it. You've been given that expiry date. You're, as I said to you before the show, Dr. Christina, one of the doctors just rolled in on the morning after I was placed in the hospital and said, "You have 6 years left to live, maybe 7."
That's wrong, right? Nobody knows that. That's wrong.
But then I can't, I just put all my energy into feeling better. And I just used all the tools I had in my toolkit from previous shows I've done, the attitude shift, the self-growth writing I've done, and all that kind of stuff. I just started to put that in. John was there to help me all along the way, and he gave me his finger to hold on to when I needed extra
finger. And I think when you were saying that, Siobhan, and it reminded me of when we talked about it earlier, when this was first happening, and you were saying this doctor gave you an expiration date. And that always sticks with me, because I think, really, how dare they? And I always think to myself, answer that, hope has no expiration date. So if we hold on to that, then we can tackle this as long as we need to, for sure.
It was interesting, because I did ask for a new oncologist, and
there you
found
go.
me the top oncologist, and she took my case. She's so busy, but she took my case. And I remember when she came in and I was lying there in bed. I'm hooked up to oxygen. I can barely breathe. And I looked a fright. John actually got a couple of pictures. So people will believe that I was in the hospital. But she looked at me and she said, "We're going to destroy the cancer."
Yeah. Yeah.
Oh, okay. We could do that. That's great. All right. I can get on board with that. Right. So it really is in all the way, your bedside manner,
Well, you want to pick somebody that really agrees with your outlook on life. And I think I love what you said, Stacy. And I always say to patients, as long as there's treatment options and you're willing to try them, there's hope. Treatment is hope. And I think that that's so wrong to give anybody, a date, particularly for your situation, Siobhan, as we talked. I mean, there is really none. There are so many treatments available. So that was really wrong. And I'm sorry you went through that.
Yeah.
I know that I'll live to a ripe old age, and I might not die of breast cancer. I'll die of something else.
Exactly.
I could easily be hit on the head. And that's, have a car accident. So I realized that now my lung is sealed. I'm in much better frame of mind because I'm not gasping for breath or worried that if there is no medical treatment that, I'll only have a few weeks left to live because my lung will, my lungs just, when you see the pictures, someday I'll write a book. When you see the pictures, you'd be like, she was still breathing because my lungs were white. It was crazy. So Dr. Christina Pozo-Kaderman, Coping with Cancer in Early Adulthood. We are giving a book away to an audience member, and I was hoping that we would find some audience members on the live show as well. But what I'll do is I will do a social media call out and some sort of, you have to like, share, and, comment type of thing. And we're going to give one of your books away. And I want to say thank you to you and Saul Wisnia and Simon & Schuster for sending 60 books for us to include in our gift bags for the holidays that are going to breast cancer patients that are in the cancer clinic and hospital here in Scottsdale that I go to. And if we can't find enough locally, we're going to put out a call and find the women that really need this little comfort. And this book is one of the key ingredients to that gift bag. So thank you so much. And I hope to see you on the show regularly.
Yeah, we have to do another one.
Thank you so much, Siobhan. Thank you so much, Stacy. I'm so grateful to you. Thank you.
Thank you all. Okay, have a great one. We'll see you again, Dr. Christina, for sure.
Bye. Thank you.
Okay, bye.